All right. Hello, Ashley again. So I just want to kind of recap what we've already went over. So I've already identified you. I've already introduced myself as your nurse. I've already washed my hands and provided privacy. And we've already did your vitals um, that were ordered along with your pain assessment. So the next assessments that the doctor wanted us to administer will be your respiratory assessment.
Okay.
This is simply listening to your lungs, and then your cardiac assessment, which is simply listening to your heart. And
Okay.
then we want to educate you on some fall prevention education. So we're going to go ahead and get started with your respiratory assessment. I just want to ask you, have you had any shortness of breath?
No, I don't
Okay.
believe so.
And have you had a cough recently?
No, I haven't.
Okay, perfect. All right. And then just a note for this purpose, your respiratory rate was 16 when I took your vitals, and you had what's called eutonic breathing, which is normal sustained breathing, and it was in a normal pattern, so nothing to be of concern there. So I'm just going to go ahead and listen to your lungs.
Okay, great.
All right. So every time that this stethoscope, which is the diaphragm of the stethoscope, touches your skin, I just need you to take a deep breath in and then release it. I'm
Okay.
just going to listen to your lungs. And so I'm going to be in your upper lobe, left upper lobe. I'm going to move over to your right upper lobe. If you could just go ahead and displace your right breast, and I'm going to be in your left or right lower or middle lobe, and then your other breast, and then this is your left lower lobe. Perfect. And if you could take your left arm and place it over your chest like that, and I'm gonna listen to your left lower lobe. Perfect. And if you could take your right arm and do the same thing, I'm gonna listen to your right lower lobe. And now I'm just gonna go to your back. I'm just gonna move your hair a little bit. And I'm gonna be in your left upper lobe. Go ahead and take a breath. Moving over to your right upper lobe. I'm just going to slide down over your scapula to your right lower lobe. Then over to your left lower lobe. Okay, perfect. All right, and everything sounded good there. All right, so the next thing is I just want to, since you didn't have a cough, um, since it is flu season and COVID season and all that, I just want to teach you something that will help you if you ever do get a cough and you're trying to get mucus out of your lungs. And so we have what's called the turn, cough, and deep breathe. And so pretty much what you would do is you would turn your head uh, whichever way, to the right or to the left, cough, and then take a deep breathe out. And you want to do this every 2 hours.
Okay.
So you would just simply turn your head, cough, and then breathe out, and that will help get rid of any of that mucus that is in your lungs.
Okay.
Um, the next thing is another thing that will help your lungs is this is an incentive spirometer. And what this little machine will do is, and what you want to do is do it about 10 times every hour. And this is going to help expand your lungs. It gets down into the alveolar of your lungs, which that's where the exchange of oxygen takes place. And it just helps expand your lungs. And what you want to do is take a deep breath in and then breathe out until all your breath is out into the incentive spirometer. You don't have to do that right now, but
Okay.
I'm just teaching you how to use this spirometer. So, any questions with those?
No.
Okay, perfect. All right. Any questions with your respiratory assessment?
No.
All right, awesome. Well, I'm going to move on to your cardiac assessment, and this is just simply looking at your heart.
Mhm.
And the first thing I want to do is I want to take a look at. First thing we look at is to inspect your to see if there's any venous jugular venous distension.
Okay.
And what this would be is if there was any heart signs of heart failure. Specifically, it would be your right side heart failure. Um, Fluid would begin to build up, and it would show in your venous, um, your jugular vein, which is on the side of your neck. But the only way I can see that is to have you turn your head to the right, and I'm gonna tilt you back about 45 degrees, and just look all the way that way. And I'm just taking my pen light, and I don't see any distension here in your jugular vein. And I'm going to have you look to the right, and I'm looking for distension in your jugular vein, and I don't see any, so that looks good. Thank you. All right. All right. So the next thing I want to do is I want to just we've already taken your pulse and your radial artery, but I'm gonna start listening and feeling bilaterally. So on both sides of the body, I want to feel your pulses to see if they feel the same, see if there's any difference in the pulses, and then I want to also check for edema, which is mainly just swelling or fluid buildup in your extremities. And we're going to check your arms and we're going to check your legs, if that's okay with you.
Sure.
So I'm palpating the right radial pulse. It is a +2 regular rhythm. And we'll palpate the left pulse, which is also a regular rhythm, +2, which all that means is it's normal. All right, and then I'm gonna checking for edema. No signs of edema. And we'll check for capillary refills. They should be under within 2 to 3 seconds refilled. And your left arm or left capillary refills look fine. It's exactly 2 seconds. All right, perfect. Now I'm just going to check your pulses on. So this will be the right side of your body. This pulse in your foot right here is what's called the dorsalis pedis, and I'm gonna feel that pulse. And I got a +2 regular on the right side, +2 regular on the left side. And then I'm gonna check the posterior tibial, which is right under this ankle bone right here, on the medial side of both your legs. And I have +2 regular and a +2 regular on both sides of your posterior tibial. Now I'm just going to check for edema in your legs. There's no signs of edema here. On your right side. Your left side does not show any signs of edema. And now if I needed to go further, just for the purpose of this assessment, I could also go into what's called your popliteal pulse, which is right behind your knee. You also have a femoral artery right in your femoral area. I could also test for that. We've already did your radial. You also have a brachial artery I could check for. And then you have an axillary artery and also a carotid artery. And now I'm going to listen to your heart, if that's okay with you.
Mhm.
Okay. Now, have you had any chest pain recently?
No.
Okay, perfect. All right, and I'm going to use your diaphragm now. If I have any concerns that there's any, if I don't hear the S1 and S2 sounds of the heart, which are the normal lub dub sounds that I would hear, I could turn this around and use the bell of my stethoscope and listen for any murmurs, but only if I have any concerns. Today will I do that. Okay. Now I'm just going to go over your clavicle bone right here, and I'm going to go down to your second intercostal space, just to the right of your sternum, and this is where I can hear your aortic pulse, or yeah, your aortic valve. And then I'm just going to slide over to the same second intercostal space on the left side, and this is where I can hear your pulmonic valve. And I'm just going to slide down to your third intercostal space right on the sternum here, and that's called Erb's Point. That's just another place where the pulmonic valve can be heard. And if I could have you displace your left breast, I'm just going to go right under, and it's actually in the fourth intercostal space, and this is where your tricuspid valve is. Listen to that. And then I'm going to slide down to the fifth intercostal space. This is where your mitral valve is. This is also the apex of your heart. This is, if I had a concern with your pulse earlier, I would have taken your apical pulse, which I would have to do for a full minute, and I would see if there's any difference in the pulse. Okay, perfect. Everything sounds good there. I'll make some notes here. All right, so perfect. All right, perfect. It looks like that's wraps up our cardiac assessment. The next thing I want to do is we already went over your Morse fall scale questionnaire, and you stated you didn't have any history of falling and there was no secondary diagnosis or anything. So you actually fall in line with there is not a concern with you having a fall, or you're not a fall, would be considered a fall risk. But I do want to, just in case anything ever does happen, and normal things that are in your environment at home that could cause you to be a fall risk, would be putting down the rubber matting, or there's even strips you can get to put in your bathtub to prevent any sort of slip and fall incident that would be in your tub that would put you at risk for having falls, and it could also injure you. And then also any loose rugs that you have at home. I know some people just throw a rug down and that's all they do, but if you don't put any tape underneath the rugs to hold it down to where the corners aren't rolling up and causing a trip hazard, or any cords, whether it be extension cords or any lamps or anything that plugs in, leaving cords out in the open, that would cause a trip hazard that would eventually put you to be a fall risk and could cause injury. So I just wanted to give you those tips just for this assessment, since we did do the fall scale, the Morse fall scale, and everything looks good today. Is there any questions that you have for me before I'm going to go enter all this into the computer and so the doctor can see everything?
I don't think so.
All right, perfect. Well, I will see you next time, Ashley, and you have a great day.
Thank you. You too.